Hello and Assalamu alaikum. Ultrascan Diagnostics. Said this is the CBCT of the patient which you had requested. The area of interest is the lower left 7 and the upper right 7. The lower left 7, as you can see, is an edentulous area. This is the panoramic view. On the transaxial view, which is basically the proximal view, we can very clearly show you that the lower right 7 has, this is where the roots have been extracted from, this area right here. There you go. So this is the area where we've got a bony defect, but to calculate the measurement of the ridge, we've got approximately 10 millimeters of ridge width with a good 10 millimeters of height. But other than that, we've got very radio opaque solid bones. This area has zero cancerous bone around the extracted socket, so we would highly recommend placing a graft in this region, either post implant or prior to the implant. But we do have very solid D1 quality bone with very minimal bone loss. So the measurements are 11 millimeters in width and approximately 10 millimeters in height. So a 8 millimeter implant can easily be placed here. As you can very clearly see, you've got buccal cortical plate and you've got this is the lower left 8. This is the lower left 6. As you can clearly see, we've got endodontic treatment, but periapical radiolucencies in the mesial and also periapical radiolucency in the distal root as well. So both the roots have periapical radiolucency, which can be very clearly seen right here. The lower left 5 also has a periapical radiolucency, as you can very clearly see, periapical radiolucency right at this point in the lower left 5 as well. The doctors asked us to evaluate the upper right 7 as well. So the upper right 7 for crack, we don't see any periapical radiolucencies, we don't see any PDL widening of sorts. But for a better crack evaluation, we're going to move to the axial view or the top to bottom view. So the upper right 7, this is the upper right 7. And here also you can very clearly see, we don't see any signs of any cracks at this moment. Moving further down, nothing problematic, no PTL widening, no radiolucencies. So we don't think the upper right 7 shows any cracks. This is at 150 micrometers of slice size. The only thing we can remotely identify is this lesion on the distal aspect and this one on the mesial. So if it's on the buccal and extending from the distal to mesial clinically, we can see it here at the mid-tooth level, at the orifice level. But other than that, we don't see anything major in this section. The last tooth the doctor has asked, the lower right 7 for endodontic treatment. This has a radio opaque restoration with where you can see there is a palatal lingual cusp is fractured. The restoration is very close to the bulk. This tooth might need an endodontic treatment. If we move to look at the canal morphology, the lower right 7 has a very interesting morphology. This is the pulp chamber. As we move further down, we've got two canals in the mesial, one canal in the distal, and they all three of those canals join to form one at the apex. So this tooth has one canal at the apex, right here, and then when we move towards mid-root level, you've got two canals, mesiolingual, mesiobuccal, and distal. And our approximate working length for this tooth is going to be 19 millimeters. Thank you very much.